Hi, I'm Dr. Diane Sutter at ahappyvagina.com. Today we're going to talk about calcium. Of all the supplements that you need to be most aware of, one of them is calcium. You're always building up and breaking down bone. You put your peak bone density down, the peak velocity during puberty, and you've maxed your bone density by the time you're 30. You're always building up and breaking down bone. In fact, in about a 3-year period, you completely recycle your skeleton. You always need calcium coming in because your body will take your bones to dust to protect your serum calcium. Your blood level of calcium will always be normal except in a few specified disease states or if the lab left it on the table too long. So, a premenopausal woman needs approximately 1,000 milligrams of calcium. A postmenopausal woman needs approximately 1,200 milligrams of calcium. We prefer that you get your calcium from food sources. 1 glass of milk, 8 ounces, has 300 milligrams of calcium in it. It doesn't matter whether it's skim, whole, chocolate, soy, almond. As long as its last name is milk, it has approximately 300 milligrams of calcium in it. Yogurt has more calcium than milk and has about 425 milligrams of calcium in an 8-ounce serving. The difference between Greek yogurt and regular yogurt is that with Greek, they've poured off all the probiotics, leaving you the protein and the fat. Well, we like probiotics. Probiotics are a good thing. They decrease the amount of plaque in your mouth. They give you good gut flora and a happy vagina, which is how I came to the name of this website. Other food sources of calcium include hard cheeses and soft cheeses. Hard cheeses, 1 ounce of hard cheese has approximately 200 milligrams of calcium. Soft cheeses, not as much, maybe 125, 150 milligrams of calcium in a serving. Now, the vegetable sources are not very high in calcium. Broccoli, kale, collard greens, 1 cup cooked has approximately 300 milligrams of calcium. So your spinach salad that you have every day does have some calcium in it, but not near as much as you might think. Almonds have some calcium, a half a cup of almonds, perhaps about 100 milligrams. Calcium fortified orange juice is a good source of calcium. That has about 300 milligrams to an 8-ounce glass. There's been some controversy in the media lately about calcium. And the punchline is that is not the definitive study. A study came out that said that dietary calcium supplements could cause cardiovascular disease. Well, inadequate calcium causes osteoporosis, and many scholarly articles were published refuting that first study that called supplemental calcium into question. Now, what calcium should you get if you need a supplement? If you're taking a multivitamin, most multivitamins have 200 milligrams of calcium in them, which is helpful but not near meeting your requirements. So then calcium basically has 2 forms. Calcium carbonate, which is the one found in almost all calcium supplements, and calcium citrate. Calcium has to have a first and a last name, and as soon as it hits your stomach, it's cleaved, and the calcium goes into your body, and the other filler goes out. Calcium carbonate is well tolerated by the vast majority of women. However, about 5 to 10% of women find that calcium carbonate gives them constipation, stomach upset, gas, agita, and if you are one of those women, then you need to take calcium citrate, which the brand name Citracal comes to mind. Calcium has to be dosed twice a day if you're getting all of your calcium from supplement because you're lactose intolerant or whatever the case may be. So you have to take a calcium in the morning and a calcium in the evening. And it's hard to remember the second dose. The only supplement I'm aware of that you can take once a day that will fulfill your calcium requirement for the day is Citracal Slow Release. which is a relatively new product to market, and 2 tablets will give you 1,200 milligrams of calcium. Well, how much is too much? It's unfair to say that calcium supplements will cause kidney stones. Dietary calcium in excess of 3,000 milligrams a day is not advised because of the possibility of kidney stones. But most people, unless they're eating Tums as M&Ms, aren't really at risk for that.